Welcome back to Diabetic Foot Files. Did you know before blood moved and a man had to prove that it actually did? But before circulation actually existed, they did not believe, before the 17th century actually, they did not believe that blood actually circulated. For about 1,400 years, the dominant belief came from Galen, whose teachings ruled the Western medicine. So, according to Galen, blood was made in the liver, food was converted into blood, blood flowed one way to nourish the organs, organs used up the blood, and the heart was not a pump. It was a warming furnace, according to them. And the blood drifted back and forth and not in a loop. And there was no concept of return, reuse, or circulation. Blood was seen as a consumable substance, not a dynamic system. So this belief explains why they thought that chronic wounds were thought to be local rot in quotations. Tissue death was blamed on member imbalances of the humors. And remember, doctors focus on bleeding the patient instead of restoring the flow. So ironically, medicine treated poor circulation back then by removing more blood, which is kind of crazy, right? But there was a man named William Harvey. So enter William Harvey. Who was William Harvey? He was an English physician, educated at Cambridge and Padua. He was a royal doctor to King Charles I, and he trained in anatomy, surgery, and experimentation. Okay, he did experiments. But what made William Harvey different was not his title, but he questioned what everybody else accepted. And that's key factor of a great scientist. Remember that. You should always question it, okay? And this was the question that changed medicine. He didn't just readily accept it that, hey, blood was made in the liver. Harvey asked a simple question, but it was, dangerous question because it questioned an accepted belief of Western medicine. If blood is constantly being made and used up, how can the body survive producing that much blood every day? So he did something radical. He measured the blood. So, how Harvey discovered the concept pretty much of circulation. So, he had mathematical logic, and now you can see why we have to study like calculus in medicine, right? So, William Harvey calculated the blood ejected per heartbeat, heartbeats per hour, and total blood volume moved. And the result was the liver would need to make hundreds of liters of blood daily, which he concluded was impossible. So his conclusion of these findings, these logical mathematical findings, okay, of remember the amount of blood ejected per heartbeat, the heartbeats per hour, and the total daily blood volume moved. And I don't really want to know how he found that all out, but his conclusion from his scientific findings was that blood must be recycled. It must have been recycled and not consumed. So he did these venous valve experiments. So Harvey pressed on veins in the arm and observed that the blood moved in one direction only, that the valves prevented black flow, and this plays a huge role in our wound care, right? The blood returned towards the heart, and this proved that blood had a destination, not a destination of randomness, okay? So William Harvey observed living animals. This is his direct observation of the heart, and noted that the heart contracts to push blood and it relaxes to refill, and motion created pressure. So this shattered the Galen idea that, blood was made by liver and it was consumption and all this jazz for Western medicine, and that the heart was not just heating blood. The heart was moving the blood. So he presented a publication, which researchers do. We present publications of our new research findings, okay? That's the whole point. So, publication that shocked the world. So, in 1628, Harvey published the Motu Cordis, okay? And forgive me if I said that wrong, but I'm going to spell it Demotu, Cordis, okay? I think everybody knows that. And what does that mean, Cordis? Demotu Cordis, on the motion of the heart and blood in animals. That's pretty much what he like described it as, okay? And his core claim was that blood moves in a continuous circuit driven by the heart. And this was like hearsay for them. Doctors mocked him. Who hasn't been there? We all been there. Patients stopped seeing him, and colleagues resisted him. Isn't that crazy? But Harvey was right. The homeboy was right, right? So why does this discovery matter? And just remember what the people did. They mocked him. The doctors mocked him. Patients stopped seeing him, and the colleagues resisted him. But homeboy was right. So, why this discovery matters. So, William Harvey proved that life depends on movement. Okay, we all know that. Tissue lives only if if blood arrives there. Stagnation equals disease, and flow equals survival. And this discovery laid the foundation for vascular medicine, cardiology, surgery, wound care, and limb salvage, and ultimately every diabetic ulcer we see today. So, in translation, William Harvey is the English scientist who measured, observed, and questioned authority. Okay? Remember, he thought, like, how could possibly the liver make that much blood every day? So, like we said, blood moves in a continuous circuit. So, what does that mean? What does that concept mean? How exactly does circulation work? Okay, so let's go step by step. The heart contracts, the blood exits under pressure. Okay, two, the arteries carry oxygenated blood outward to the organs that need the blood. Okay, the blood reaches the capillaries. The oxygen and nutrients exchange. There's an oxygen and nutrient exchange. The veins return the deoxygenated blood, and the cycle continuously repeats itself endlessly till the day we die. Okay? So, flow requires motion, patency, and pressure. Lose one of them, and that causes a failure. So, what does this mean for diabetic foot ulcers? Diabetic foot ulcers exist because the motor cordis fails at the periphery. So in diabetes, as we know, the arteries get stiffened because we don't know about that end glycation products, okay? Capillaries collapse, the blood thickens, the endothelium dysfunctions, and motion becomes sluggish. And what is the result of that? Oxygen starvation, poor immune response, failed collagen synthesis, which we definitely need for our lay down foundation of skin, chronic inflammation, and tissue necrosis. And a diabetic ulcer is not just a skin defect. Remember, it's a circulatory collapse at a micro level. So let's talk macro versus micro. This is critical. So a patient may have palpable pulses. A patient may have an ABI that may appear normal, right? And yet the wound still fails. Why is that? Because macro motion does not guarantee micro motion. And remember, a lot of diabetics have microvascular disease, okay? And capillaries are where healing happens, oxygen is delivered, and cells survive or cells die. So no motion here, like microvascular disease, means no healing. So how does motion improve the blood flow? And remember, the woman talked about a walking program to create collaterals, okay? So motion is not an option, it's therapeutic. So movement helps by activating the muscle pump. Remember, we all have muscle pumps in our legs too, enhancing the venous return, improving the endothelial nitric oxide release, reducing blood stasis, and preventing clot formation. And this is why complete immobilization delays healing and people are at higher risk of getting a blood clot, okay? Safe That's why they make you walk, and have the compression stockings and things like that. Safe controlled motion improves outcome and compression works only when motion exists, okay? So let's continue this as a clinical application and when it comes to limb salvage. So modern limb salvage is applied to D Motu cordis. So ABI over TBI is measuring the motion. Doppler is listening to the motion of the blood. Revascularization is restoring the motion of the blood. Offloading is redirecting the motion of the blood. And exercise is enhancing the motion of the blood, and glycemic control is preserving the motion of the blood at a cellular level. So we're not just treating wounds, we're literally restoring the circulation of wounds. So what did D. Motu cordis teach us? And thank you so much, Dr. William Harvey. Taught us that motion is life, blood must move to heal, that's why we like nice little bleeding, healthy tissue. Stagnation kills silently. Wounds reflect systemic failure, and limb salvage starts with circulation. And that is why I am still the number one fan. I am a definite fangirl of vascular. Nobody can change my mind. If anybody said I'm a fan of anything, I'm a fan of vascular. Like I said, me love you vascular. So, a wound that does not heal is not stubborn, it's starved. You have to think about that, okay? And before William Harvey, blood was thought to disappear, which is crazy. But after William Harvey, he actually questioned the concept that was already accepted. We could understand something that's kind of terrifying, but also fascinating and powerful at the same time. That when blood stops moving, tissue dies. So I hope everybody enjoyed this episode of Diabetic Foot Files. It was an interesting one, just learning about the history of the blood and circulation, how vital it is. And this is Dr. G. Take care of your feet because they take care of you.